Thanks a lot, Mark, for agreeing to have this discussion today. I appreciate your time. So why don't we start with a quick kind of introduction about yourself and Project Find, and then we'll dive into discussion around technology and the areas around technology that it relates to older adults and the aging population.
Great. My name is Mark Jennings. I'm the Associate Executive Director of Project Find. Been here at the organization for about 4 years, and prior to that, worked at Community Access for 10 years, which is a supportive housing agency. Here at Project Find, I'm over our housing, our human resources, IT, property management, and probably leaving out fiscal departments, and work alongside our executive director, David Gilchrist, with our senior centers just as well. So again, in general for us, our primary focus is older adults as a mission, and we have 4 senior centers, over nearly 700 units of housing, and a homeless in-reach program where we provide services to older adults who are street and transitional and in shelters.
Awesome. Thanks a lot. I appreciate that context. Great services you guys provide to the community at Project Find. So let's dive into the discussion. Today's discussion, we would like to kind of focus a little bit on disrupting some of the methods around older adults, the aging population, and the technology, and to elucidate the opportunity to use the technology to reconnect older adults to the community, basically. That's kind of the core mission we have at Blooming Health, and we would love to kind of learn from real world examples that organizations like yourself experience and kind of build toward that. So to kind of get started here, let's start with the discussion around where the population you serve stand in terms of their capabilities and access with technology. Let's start with some kind of demographic introduction about the population, and then connect that to the technology in terms of their access and abilities, etc.
Well, so our demographics vary depending on where we are. So our average age in much of our housing is 70 and 80 years old, just to give you some backdrop. In our housing range, our housing to enter, like our Woodstock location where we primarily work with homeless individuals, the entry age is 55. Our Hamilton and Hargrave house, the entry age is 62. We also see different dynamics around race and socioeconomics based on where we are. So again, our Woodstock has a more very low income sort of population. We skew more African American and Latino in that segment, which really kind of represents those folks that are in shelters and streets and everything, because 60% of that housing is set aside for that. In our uptown houses, we see a little bit different demographics where the rent is a little bit different, and some people are coming there by reducing income and scaling down and et cetera. But we also just have low income and people with vouchers, et cetera. So we see that as a part of our demographics, and that same sort of reverberates through our senior centers just as well, where Woodstock and our Coffee House senior centers, we cater to homeless individuals. We see the same sort of demographics. As that relates to technology and sort of our folks, I like to look at it as sort of pre-COVID and post-COVID, right? So because pre-COVID, we really didn't think about technology all that much. I think the assumption was, people can't do that much, right? And right or wrong assumption. And so we're not going to try to put too much on folks. Yes, we referred people out to programs like DeRote that had programs if people wanted to learn how to use their telephones, if people wanted to learn how to do smart TVs or something. They had excellent technology programs where you can pair older adults and have them do that sort of learning. And we would do those sort of one-to-one things as they came up with people who were primarily interested. But I don't think that we really, wholeheartedly sort of thought about the use of technology in grand ways, other than we shouldn't use it. And I'll, even before I get to sort of our housing, want to just bring it back to the employment side, because we introduced sort of an HIRS system only a few years ago here at Project Find, and it was paper timesheets and all those things. And in the beginning process of that, our workforce is majorly 55 and above. And so, it was a thing of, we can't do that. We can't bring that kind of technology because people are not going to understand it. People are not going to get it. And so we can just see from there sort of where the mindset was of looking at older adults and in the use of technology. So that's sort of pre-COVID. I think what COVID did, other than kind of give us all headaches of trying to figure out the logistics of this thing that's taken over our lives, is it forced us as an organization, and I think us as people, to really wrestle with technology in different ways. I think things like Zoom at Community Access, where I was, they had Zoom prior to Zoom being Zoom. They came in, they set up the conference room. They had a Zoom conference room. They began to sort of engage Zoom probably 5 years before COVID. And I'm sitting there looking at this like, this is great, it's okay, but had no idea about the capacity of how it could connect the sites, right, from the Bronx and Brooklyn, and make the world smaller in terms of cutting down travel and cutting down time. And that's just on the employment side, but also connecting with people. What we found when COVID first started, we did a technology survey. And one of the things that I found in that technology survey, like, for example, we asked people, do you own a laptop or computer? So we had 316 respondents to that, who, and 78% said no. So they didn't have a laptop or computer. Do you have a tablet? 85%, no, we don't have a tablet. Do you have a smart TV? 75% no. Do you have access to the internet? 54% said no. Do you have a landline? Right? People did have landlines, right? And so, but we also had to get to the place of, then do you have cell phones? And even break that down to, do you have smartphones or other things like that? Like 72% had cell phones, but when you started asking about smartphones, only 50% of the people had those. So we did that technology survey early on to be able to kind of get a sense of, we knew that we needed to sort of shift things from brick and mortar to an online framework with the rest of the world, and kind of where we are now 2 years later. But what did we need to do as an agency to help that process? So that survey just alone told us, all right, it's not just about the flip phone, right? You can have that, but that's not going to get me into a Zoom class at my senior center. So how do we get people access to the technology? If I have the technology, if I don't have the internet to power the technology, that's going to be null and void anyway. And so how do I help people to understand what's out there, even in some of the entitlements that are there? When you think about what the phones, which some people commonly refer to them as the government phones, right? So if you have a certain income, you can get certain phones. Even those phone companies moved to introducing smartphones as part of their plans, where you can get a smartphone for $30 a month or $25 a month or even cheaper. And so we were also looking at, how do we bring those resources to people? If I can't put internet in your apartment, can I put internet in your hand so that you can still access various services? And so that was sort of post-COVID what we were doing. I can talk a little bit more at another time about what we're doing in our programs, but moving online necessitated that. And just to sort of wrap that up, I mean, we, in our buildings, our housing, we used to have tenant meetings that we introduced where people came together and we talked about what was going on in the buildings, and the tenants could yell at us and tell us what we're not doing right and what we could do better. And those were great times. And so we wanted to move those to Zoom. And the initial, again, from the staff side, the initial piece was, that's not going to work. We can't do it. People don't know how to use Zoom. People don't know how to use phones. Can't do it. And much of that was really about their fears as well, because they were having the anxiety of using Zoom newly and using these technologies. And once we got into it, now we've noticed how it's actually been helpful. So some people who could not come to the meetings prior because they had to work now can have access to those meetings and be able to come. Zoom allows for the people who, I can't use the computer, but I can still pick up my phone and still chime in. So we have sort of that hybrid model where folks with just phone can participate. Folks who are outside of the building can participate. People can have their faces if they so choose. And so we've actually brought more people and been able to reach more people than we did when it was just come downstairs and, you know, come enjoy some coffee and let's sort of talk. And that's been really beautiful in introducing technology.
That's awesome. It's a lot of learning in a very short span of time, a lot of change of operational logistics and model in a short span of time. Also, a lot of change in our behavior as human beings in a short span of time as well. The way we used to do stuff is changed over time. One of the things that we have learned through our kind of partnerships with different communities is that a lot of these challenges we face are a lot more persona dependent than age dependent. Meaning, for instance, the socioeconomic status might impact the access to technology more than it would, more than age would impact the access to technology. So that being said, I would like to kind of dig into a little bit more and learn what solutions you guys have used to be able to kind of remove some of the barriers here. We know there is technology access barrier. We know there is technology literacy barrier. We know there are language barriers. What are some of the maybe tools, methods, ideas that, or resources that you have used to be able to remove some of these barriers for your community, basically?
Yeah, I mean, I think that's a real big thing, because finances, I mean, it takes finances to sort of make these things happen. And we're talking about older adults, but we see that in schools. And I think the older adult persons kind of really reflect that on the opposite spectrum. I mean, where you know, yes, it's great, schools are moving to online learning or Zooms, but you know, who has a computer, who has internet, some of those things. And schools had to sort of pivot and begin to think about, how do I get free internet out? And when that was happening, I have children, that made me think about the folks that live in our buildings, the people that are in our senior centers. And not just, that's why we ask these particular questions on the survey, not just do you have devices, do you have the thing that needs to power the device, and trying to look at your income, because you know, if you need to get internet, what does that mean that you know, do you need to not spend money somewhere else, or are there ways to be able to fit that in your budget without sort of making you go broke? Because you can also go broke depending on what you have. And I think number one is about really educating our staff and our social workers and everybody about the bevy of ways that you can, you know, the different programs and everything that's out there, just like phone companies, right? So being able to, when we're talking to people about smartphones and phone plans, we give people, we let them know, you know, you might be paying $80 for a landline nowadays because that technology is so outdated, that what if you paid half of that? You know, could get us, what if we could show you how you could pay half of that and get a cell phone and walk around with it and do all these things. And that might be scary, but let's talk about that. Let's show you that. Let's map that out on paper. And so we use those kind of devices to really help people see how sometimes it might be a cost savings in what you're doing. Some people still had minute plans where they were being charged over, because again, when I purchased my phone, I might not be thinking like, you know, people like me that are coupon folks, right? I'm going to want to know, how can I save on my insurance every year? And I'm gonna call you and I'm gonna ask you questions. Not everybody's like that. So I might have bought my cell phone plan 30 years ago when they still have roaming charges and still have, you know, maybe two-tier things with regional dialing. And so we're helping to help people to really understand their plans. I think the other thing on economics, especially in our spaces where we've been working with people coming out of the shelters, we've been putting in grants, and we just won a small grant of about $40,000, which we wrote to try to one, create internet hubs in our social work office and in the senior center, where people can, if you don't have access to the internet in your room or your apartment, you can be able to come down instead of going to the library or going to other places which might be closed, or because of COVID, you don't want to go out as much, and trying to be safer. We want to try to create that space for you. But we also wrote in tablets and also wrote in trying to creating, utilizing our social work staff, at least 1 or 2 members, to run groups to be able to help people understand how to use the tablets, how to get connected to information, so that we want to really give them a point person that they can call, like a 311 operator, to just know I'm having these sort of IT issues, things like the Geek Squad at Best Buy. We want to bring that to you in your building. So what you think might be a dumb question really is not a dumb question. I mean, or we'll take that quote unquote dumb question and help you work through it, because you wouldn't have the courage or something to ask somebody else for it, or maybe you don't even have the intergenerational partnership, because a lot of times, and that's another thing that we encourage too, is intergenerational partnership. So connecting with grandchildren, connecting with other folks, being able to see technology, not just for work, right? Not just how do I get to doctor's appointments, not just how do I get food, not just but how can I use it for social things, for fun, for dating, for being able to just see, like you look at all the new technology with Facebook or other things. We talk about not just the dangers of those things, because we got to couple that as well with the dangers of your information. How's your information used? But with, I can now connect with my child in Mississippi and be able to talk to them. And maybe that brings me and gets me out of a place of being isolated just by using technology. So I am a firm believer that that technology, the biggest barrier is learning. And I think that's not even an age thing. And that's where I am, is that it's not about age. We'll just throw it out and let's try to see what people can do. And there may be some things that are mobility, agileness, and some other things depending on what type of devices. But I think that's the other beauty of technology, that it tries to evolve with the customers that it has. If you think about the jitterbug phone or something that is created, like I gotta have bigger numbers. So that's the whole niche of that whole phone company and other things.
Yep. That's awesome. This is great, and I think there's a ton for organizations to learn from each other as well, from each other's experiences as we go through this together. I wanted to get back to your services and your kind of community. How did the community react to it? How did the services change, service utilizations for the community change, and how the kind of aging population in your community now are living in this kind of new world that is technology. The technology is a key component of the support system around them.
And I think that, one, I want to say that I think that people surprise themselves in
Yeah.
terms of what they could do with technology. And I think that as human service workers, I want to venture to put my money on that even as an industry, we were surprised at the resiliency of individuals in picking up technology. And I think that it's really changed the industry for the better, and hoping that many things will stay in place. And that's all the way from, if I think about housing, from a person coming into housing used to have to, they got a letter in the mail to go get a briefing if they had a Section 8 voucher, and they had to travel down to 100 Gold Street, all the way in the financial district from wherever they are in the Bronx or wherever they are in New York, right? And go down and sit this briefing and waste a whole day. And if you miss it, you got to do that all over again. And I've spent this money, and the headache of that. And now their HPD, the government, right, is using YouTube to be able to do some of those briefings. And now they can just make a phone call to you after you view, ask you a few questions, and that whole process that you had to go downtown for and waste an entire day is now can be done in 15 minutes or at your leisure at different spaces. If I'm homeless, that's great because I only have now, I don't miss it as much, or miss the hearings because I didn't have money, I didn't have it, and I can move into housing a little bit better. That's just the housing side. I mean, the senior centers, we know, have adapted, moved to online classes. We're seeing a lot of hybrid coming back into the models, and I expect that that'll be the way of the world, right?
Yeah.
That DIFTA will continue to evolve and see that as valuable. I think the members see it as valuable. I think the staff see it as valuable to be able to provide access to people, one, who may not have had access prior, and to also be able to provide more access to people who want more but can't necessarily travel and do everything to a brick and mortar site. And even again on the workforce, I think just being able to allow for some remote work to come into places has helped some staff with just quality of life things like, having children and needing to sort of balance just work life things. And I think that even that from a technology realm will be helpful to the industry as a whole.
Absolutely. Yeah, one of the things we have seen is that the remote social services and then the remote work combined with that, meaning both the provider of the service and the receiver of the services, being able to do this kind of service transaction remotely has made these services more age friendly, meaning on the provider side, employees on the higher age range that might have mobility issues are still able to connect in with their community, provide social services, social support. And on the receiver end, people that might be homebound that wouldn't be able to physically go to the centers or to the community center, they are now able to receive some social engagement, some social support, and also their needs can be tracked more accurately remotely on a continuous basis and be served better, preventing a lot of kind of headache, as you said, a lot of unfortunate catastrophic situations for some of the older adults that might be homebound. I would like to kind of close off with some of the, maybe if you have any anecdotal examples around the COVID itself that might be tied into your services or in general, like the vaccination, booster, testing, etc., and how technology played role there. And I just kind of to give you an example, something we learned early on was as the first kind of wave of older adults were getting excited and ready to be vaccinated last year, a lot of states put up websites for the vaccination sign up and appointment set up. And some older adults that might had a hard time figuring out the sign up process. I personally did it for myself. It was a long, challenging process. And also sometimes they didn't have access. They might have a smartphone, but filling out a form on a smartphone is too hard, right? So that prevented a lot of older adults being able to get vaccination on time. I wanted to see, like, if you have any examples that like this, that you try to use technology properly for the older adults and for the persona of the people you serve in the community, to be able to help them in a scalable way using technology.
Yeah, I mean, multiple things related to COVID. I mean, I'll start with in the midst of, prior to, it seems like so long ago in such a short time, right? Prior to vaccines. And when we were sort of in that red alert phase, when you couldn't get a test, right? Testing is abound on every corner now, but we couldn't get a test. And you're right, people were trying to call. We had employees who were trying to sign up, and it's like it was taking them 50 years to get a test, and the phone was hanging up, the internet would hang. And so what we did was created our own forms. And for testing, we started with testing, and we used JotForm as a platform, and created our own forms. We used our social workers to then, instead of having the older adults call or fill out the form themselves, like here's a link, you fill it out. We had our social workers. We, at that time, when the DIFTA centers were closed, we had our operations teams and our kitchen workers calling people, asking them the questions, and that would come into a centralized database, and then we would be able to farm that out to our remote folks to be able to do follow-up, to set up appointments for people. And we were partnering with pharmacies. Shout out to a Lower Pharmacy in the Bronx, and Rite Aid, Dwayne Reed in Times Square. Like, they came out, did testing for us, and that laid the groundwork for vaccines. And so when vaccines came on and you couldn't get a vaccine anywhere, we refined those forms to be able to not only do the same thing where the social workers could put it in, we expanded it where now we had people who we were connected with, community board members. They were able to connect with their organizations or other organizations. So we put on a vaccine event for 250 people at our Woodstock location, which had over 30 different organizations who were able to kind of chime into that form. And we set it up so that it gave confirmation receipts, a whole number of things that we weren't able to do sort of prior. And actually, we had begun the process, I began the process of really updating us related to online forms and those sort of things, just internally. And that stuff really came from Bill Gates. Like, I'm just reading his book, I'm looking at Business at the Speed of Thought, where he was saying, look, in 1992, he was looking at getting rid of all the paper in his agency, and let's turn things to online forms. And I was using that as a part of our HRS and these other things coming in. And that sort of morphed into all these other things around COVID and the vaccine. But I'll also say that, even post that, we were still having issue with being efficient. That takes a lot of time. All those phone calls, 250 people, that's 250 phone calls, plus follow-ups, plus all these things. And that's a lot of time, a lot of energy. We were still looking at how can we be more efficient in those sort of ways. And that was one of the reasons that I was reaching out even to Blooming Health, and even the technology that Blooming Health has helped us to be more efficient there with sort of the surveys that are able to be provided as a part of the technology related to text messaging and emails and phone calls, and that's even helped us now with sort of the technology surveys and other things we did in the very beginning. I wish I had that technology back then. We would have saved eons of time and probably been able to meet people's needs a lot faster, knowing who needed food, who didn't. We had to knock on doors and do our rounds and all of that. But I will say that one of the things that we're trying to keep in mind is, utilizing technology, but not losing the human touch. And so I think that it is it's definitely something that we have to continue to keep our eye on as we use technology, because it doesn't have emotion. And we see that in emails where we fight and argue over what you said to me when it might be what I read into your email, or trying to be careful to make sure we say hello, hi, before we launch into what our our conversation is. And I think that's very important as we expand technology for older adults and in general in the world.
Absolutely. I appreciate that. I think this has been a really great conversation, Mark. I appreciate learning about all of the experience over the past 2 years from you and beyond, obviously. And really glad that we have an opportunity to partner with you, to work with your community. I look forward to more of this in the near future. Thanks a lot for
Right.
taking the time and speaking with me today.
Thank you. Oh, and LiveOn, I just want to say, I mean, LiveOn has been a great partner with us in Project Find through the pandemic, helping us just every step of the way with all things senior center, and we definitely rely a lot on our partnerships like LiveOn and Supportive Housing Network of New York to get the things done that we do.
Absolutely. Yeah, we've heard a lot of great stuff about LiveOn from different centers. We continue to partner with LiveOn and all the kind of centers that they have as a community together. Awesome. Thanks a lot. Appreciate your time.